Assalamu alaikum. I am Dr. Nafisa Rashid, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Today I am discussing about the drugs of the malarial disease. The important drugs are chloroquine, quinine, the combination drugs, etc. At first I am discussing the chloroquine. It is a synthetic 4-amino quinine groups drug. It is very potent against the acute attack of malaria and it is absorbed rapidly and completely in the GI tract. It is extensively tissue-bound drug and it metabolizes in the liver and it metabolites also have the antimalarial effect. Its plasma half-life is 5 to 7 days and it could be given orally and parenterally also. Now, what is the peculiarities of the parenteral therapy of chloroquine? It is extensively tissue-binding drug, particularly in the liver, spleen, heart, kidney, retina, cornea, lungs, etc. Therefore, a loading dose is required for the treatment of the acute attack. And it should be given by slow infusion because if it is rapid, there may be hypotension or cardiac arrest may occur. What is the mechanism of action of chloroquine? It inhibits the synthesis of DNA in both mammalian cell and also protozoal cell and forms a complex with DNA that prevents replication and transmission of DNA. The drug interferes with the parasite's ability to metabolize and utilize the hemoglobin. The drug inhibits the phospholipid metabolism of the parasite also. What are the indications of chloroquine? It is an important question for Viva. Number 1, acute attack of malaria that may be caused by the Plasmodium vivax, Plasmodium ovale, Plasmodium falciparum and Plasmodium malariae. Plasmodium falciparum, it should be sensitive for the chloroquine. Then number 2, chemoprophylaxis of malaria in case of chloroquine sensitive malaria. And other indications other than malaria are amoebic liver abscess and autoimmune disease like systemic lupus erythematosus and rheumatoid arthritis. What are the adverse effects of malaria? Adverse effects are retinal toxicity because this type of drug deposits in the retina and causes photophobia, decreased visual acuity, defective color vision and blindness also. It also causes ototoxicity, GIT upset like nausea, vomiting and pruritus, psoriasis, and rapid infusion causes hypotension and cardiac arrest and hemolytic anemia also, because it has glucose 6-phosphate deficiency enzyme. It may, if given, then there may be hemolytic anemia. What are the contraindications of chloroquine? Patient with already visual field abnormality, patient with skin disease because it can cause psoriasis, pruritus, patient with hepatitis and patient with blood disorder. Now the second important drug is quinine. Quinine, it comes from the cinchona bark. It is alkaloid in nature. You may be asked what is the difference between quinine and quinidine. These are the isomer of quinidine is the isomer of the quinine. Now what are the pharmacokinetic properties? It is rapidly absorbed, widely distributed, metabolized in the liver and excreted through kidney, and its plasma half-life is 10 hours. Now, what is the mechanism of action of quinine? Number 1, antimalarial effect. Quinine binds to the Plasmodium DNA and prevents protein synthesis. And quinine prevents the polymerization of toxic heme to non-toxic hemozoin by inhibiting heme polymerase. Then toxic heme kills malarial parasite. It has also anti-epileptic effect and anti-arrhythmic effect also because it is voltage-gated sodium channel blocker. And it also antagonizes the muscarinic receptors, so there may be the adverse effects of tachycardia, urinary retention, blurred vision, constipation, etc. And it blocks the alpha receptor also, so it causes postural hypotension and reflex tachycardia. Now, what are the indications of quinine? Number 1 is chloroquine resistant malaria. As it is chloroquine resistant, so quinine should be given. It has anti-epileptic effect, anti-arrhythmic drug. It is used in abortifacient drug, pyrexia of unknown origin, night leg cramp. What are the adverse effects? Adverse effects are gastric irritation, synconism. Synconism is the some of the signs symptoms caused by the quinine is called synconism. They are tinnitus, blurred vision, decreased auditory acuity. Hypoglycemia, hematological abnormality, hypersensitivity, black water fever may also caused by the quinine. Pregnancy, myasthenia gravis and patient with tinnitus and optic neuritis are strictly contraindicated to use the quinine. Now, Fansidar, it is combination drug. You may be asked that name some other combination drug, but Fansidar is combined sulfonamide and pyrimethamine, and mechanism is like the anti-folate drug. Here trimethoprim is not used because trimethoprim acts against bacteria and pyrimethamine is more effective against protozoa, and malaria is caused by the it is parasitic. Malaria is a parasitic disease. Now, indications of Fansidar: chloroquine resistant falciparum malaria and cerebral malaria. Advantages: it is low cost, less resistance and easy to administer. What are the adverse effects of Fansidar? Due to pyrimethamine there are some adverse effects, and due to sulfonamide there are some adverse effects. Due to pyrimethamine there may be hemopoietic depression. As a result, there is megaloblastic anemia, leukopenia, granulocytopenia, disulfiram-like action with alcohol. And due to sulfonamide, there may be urinary tract disturbance, hypersensitivity, GIT upset, etc. Pregnant mother, nursing mother and children under 2 years are strictly contraindicated for the use of the Fansidar. Now, Primaquine, it is synthetic 8-aminoquinone derivative drug. It is tissue size onticidal and it interferes with the plasmodial mitochondrial function. Indications are chloroquine sensitive malaria, radical cure for Plasmodium vivax and Plasmodium ovale. And adverse effects are abdominal cramp, headache, methemoglobinemia, hemolytic anemia and GIT upset. Glucose 6-phosphate deficient patients are contraindicated to use this Primaquine. Artemisinin group, there are two derivatives, number 1 artesunate and number 2 is artemether. They liberate the free radical, causes injury to the Plasmodium species, thus antimalarial effect occur. Indication: multi-drug resistant Plasmodium falciparum malaria and quinine resistant malaria are indicated for the artemisinin group. It causes irreversible neurotoxicity and pregnant women is strictly contraindicated to use the artemisinin. And lastly, there is Atovakone. It inhibits the metabolism of food in parasite, no energy production, and there is death of the parasite. Indications of Atovakone are chloroquine resistant malaria, chemoprophylaxis of malaria and pneumocystis carinii of the pneumonia. That's all for our malaria chapter. Hope you will understand this lecture and get prepared for the examination. Allah Hafiz.